Hi, I'm Dr. Steve Myers, and I'm here with my patient Patricia, who is over 1 year out from a stem cell procedure on her right hip joint. She has a history of a dislocation. She dislocated her hip joint over 30 years ago water skiing, and then she had some significant continued troubles afterwards. So I want to talk to her and take a look and see how she's doing 1 year out from stem cell procedure. Before we talk to her, we're going to take a quick look at her imaging studies. Okay, looking at her x-rays, this is an x-ray looking at her pelvis. The right hip is circled in red, and there's really minimal changes going on in her right hip. She has good joint space with minimal arthritis. But looking at her MRI of her pelvis, you can see a bright defect in the right hip circled in red. This is a cartilage defect where she's lost cartilage. We can see it better on this zoomed in view where she has a significant full thickness cartilage defect involving the right hip. Okay, so regarding that right hip, thinking back to before we got busy and started with stem cell, before we did stem cell treatment over 1 year ago, what kind of difficulty were you having? What kind of troubles were you having with your right hip?
It was painful if I walked for extended periods of time. At night when I would try to sleep, if I rolled over on the hip, if I rolled on the other hip, it would stress it each time. And sitting for long periods of time, when I get up to walk, I would feel the pain. It would be hard to walk on it.
Okay. How was getting up from a chair, negotiating stairs with that right hip?
Painful.
Okay.
It would take, you'd feel like you'd need to get it kind of warmed up to be able to start. After a few steps, you're okay. Stairs, it was difficult, and I put most of my weight on my left side.
Okay.
Or use the railing.
And before we did the stem cell 1 year ago, what other treatments had you had for your right hip problem?
I went through physical therapy treatment 3 times. I had injections done in my hip to try to help alleviate the pain, the steroid injection. And it might work for just a short period of time and then come right back.
And then how did you ultimately decide to proceed with stem cell procedure for your treatment?
Well, we pretty much ran out of options, and I did not want to have any kind of surgery.
Okay.
That was my main goal. I wanted to prevent any kind of hip surgery.
So here we are 13 months from your procedure. How are you doing with the right hip?
Great. It is great. By no means, you made sure that I understood it wasn't going to be overnight. It did take a few months for the stem cells to start, regenerating, and over a few months, alleviated just nearly all of the pain. Occasionally it'll flare up.
So how are your pain symptoms with activities, walking, getting up from a chair, sleeping? How are those activities at this point in time?
They're fine right now. There's occasion if I overwork doing yard work, walking all day for extended periods of time or something, it may ache a little.
Yes.
But I attribute some of that to age as well. So,
Okay.
But other than that, it's doing great.
So compared to before the stem cell procedure, looking back at now compared to back then, 50% better, 70% better, 80, 90, 110% better, what would you say on your improvement?
I would say at least 95% better.
Fantastic.
At least. If not more, it's just occasionally if I overdo it, I pay for it, but I know that, so.
And here we are 13 months. Do you feel like you made the right decision with your treatment?
Absolutely. Absolutely.
Fantastic. Well, I'm so glad to see you're doing better. And thanks
you.
for letting me know how you're doing.
I appreciate it. Thanks.